If a neurologist follows you over a long period of time, the accuracy of diagnosis is about 70%. Think about what a family doctor has to do. They have to know everything through all those years of development, all the way to the end of life. That's a lot of information to know. A neurologist specializes in illnesses of the brain, spinal cord, muscles, and nerves. And Parkinson's disease is a very large part of that. If a neurologist follows you over a long period of time and notices your response to medication is very typical and that you develop the typical symptoms that we expect, the accuracy of diagnosis is about 70%. I don't think it's because neurologists are smarter, it's because we just see a lot of patients. And so you develop this sense of knowing when the patient's talking to you about what's happening at home, you can say, oh yes, that sounds very typical. I expect that. I've seen it hundreds, if not thousands of times. At this point, we do not have any imaging that definitely confirms the diagnosis. Almost all those reports will say it needs to be taken in the context of the person. It can be frustrating for patients and families, but to me, this is the beautiful part of neurology. We actually have to talk to our patients. Imagine that, doctors who talk to patients. And we have to ask them. We need to examine them. And then we actually need to follow them over time, because how you respond to treatment is going to be a large indicator of whether we are very convinced you have Parkinson's disease or not. There are many other symptoms that affect Parkinson's that really affect quality of life. And it's often that the patient or the family haven't connected the two because they think of Parkinson's as someone who is stooped over, walking slowly. In fact, anxiety and depression can be very problematic. And so I encourage people who are having these symptoms to seek out help from mental health experts, because the landscape of medications available and approaches available are so vast compared to many decades ago. Exercise is definitely a mainstay of Parkinson's treatment. The very baseline of activity would be 5 days per week of moderate intensity exercise, about 30 minutes each day. If you were just going on your exercise bike 5 days a week, I mean, that's better than nothing, but it would be even better if you went on the exercise bike twice a week, you went to a boxing class twice a week, and you joined your local walking club once a week. So it's that varied activity that is actually good for your body, good for your joints, and good for your brain.